Hi, everyone. This is Nazlı Okumuş. I'm an interventional fellow at Allegheny Health Network in Pittsburgh, and thank you for joining us today. We'll discuss a SCAI SHOCK meeting. And before we start, can you please introduce yourselves? And thank you so much for joining us.
Thank you. I'm Allison DuPont. I am the chair this year of SCAI SHOCK 2025 in Tampa, September 18th through 20th. I am an interventional cardiologist at Northside Hospital System in Atlanta.
Hello, my name is Behnam Tarani. I'm also privileged to serve as one of the chairs this year as the assistant chair for the SCAI SHOCK meeting in September. I'm a practicing interventional cardiologist, system director for interventional cardiology at Inova Health, and the director of the cardiac cath labs, and I look forward to this year's meeting. Thank you.
Hello, everyone. My name is Sandeep Nathan. I'm an interventional cardiologist at the University of Chicago Medicine, where I serve as the co-director of the cath lab and medical director of the cardiac ICU. And I'm the associate chair for the SCAI SHOCK meeting this year, and really looking forward to having everyone there.
Again, thank you so much for joining us today. Can you tell us what is in store for the upcoming SCAI SHOCK meeting this year?
Yeah, so we have a lot in store during those 3 days. It's packed few days in Tampa this year. We first have a pre-conference, which will be by application only, and that will be on day number 1 for a half day. The following days will be didactics and some hands-on as well. We have a very broad range of topics. So one of the things that we really want to focus on this year is to try to get more community centers, community hospitals to the program. And, with the publication of Danger Shock, a lot of community hospitals are asking, how can we up the ante? How can we create a shock program? How can we get patients safely to a shock center? So I think that a lot of the conversation is going to be around community centers, not as much focus on academic hospitals, but a lot of focus on community hospitals.
This is such an important topic.
I'll just sort of add to that. The pre-con last year brought together 15 shock teams from around the country, inclusive of interventional cardiologists, heart failure specialists, cardiothoracic surgeons, and so forth. And it was a really robust conversation that spilled over into the main meeting. So we want to build on that this year once again.
One of the great things about SCAI SHOCK is it's not a huge meeting. SCAI's a very large meeting. This is a smaller meeting where there's a lot more discussion that happens. So, we want to encourage that. We don't want to just speak at people. We want to have a lot of discussion back and forth because nobody has a perfect answer on how to create a shock team, et cetera. So all of these discussions at this meeting are really, really important.
Looking forward to hear those discussions. What are the hot topics at the upcoming SCAI SHOCK this year?
Well, as Dr. Nathan and Dr. DuPont mentioned, it's going to be a broad array of cardiogenic shock. So in addition to understanding how we can improve shock care in the community, we're going to spend some time around the different phenotypes of shock, RV cardiogenic shock, patients that are coming in with valvular disease-related cardiogenic shock. And then we're going to spend some time around some novel therapies, around some novel concepts in cardiogenic shock, upstream care in the emergency room, but also longitudinal care after discharge around shock clinics. So in this meeting, we will see the full gambit and array of cardiogenic shock, but we'll spend some time talking around some evolving concepts which we think will inform care going forward.
This is really exciting. And who do you think should attend to this conference?
Yeah, so as I kind of alluded to, we really want to get those community hospitals there. But as Sandeep said, this is a multidisciplinary program. So last year we had APPs, we had nurses, we even had some cath lab staff, critical care physicians, CT surgeons. That's what creates the discussion surrounding these important topics. So we want to encourage people from all disciplines to come to the meeting. And if you have team members that you think would be interested, bring them. Even if you're not part of the pre-conference, come to the conference as a team.
I think historically also, these kinds of conferences were attended largely by practitioners at level 1 centers. And as we sort of pan out of this shot, we're looking at shock systems of care. And shock systems of care just don't work if everyone doesn't invest in this and sort of learn what their individual roles are. So we want to encourage everyone from small hospitals, large hospitals, tertiary, quaternary, everything in between to attend the meeting and bring the whole team if you can.
That's really exciting. And yes, shock teams are huge, and we need all the members there to have these discussions. What are the other upcoming things that we should know about this conference?
I missed the question. I'm sorry. About what?
The upcoming overall, what else should we know about this conference?
The conference. Well, it's in Tampa, and it's at a fantastic location. So yes, and we were there. I was there last year. It's an amazing site. Fantastic restaurants, very walkable, nice place to visit. So I encourage everybody to come September 18th through 20th in Tampa.
Can't wait to see you in Tampa. Thank you so much for joining us again.